It is Medical Laboratory Professionals Week. Joining us live to talk more about the role and importance of these professionals is Chandra Eldred. She's a clinical laboratory technologist in the St. Peter's Hospital Chemistry Department. Good morning, Chandra. Thank you for joining us.
Thank you for inviting me to kind of speak about the profession.
And it's a good thing because I don't think a lot of people know what it is that you do. So can you tell us about the role of a clinical laboratory technologist?
Well, we are kind of like the behind the scenes in the healthcare industry. We process the tests that are ordered from physicians, surgeons, and outside providers. So we take those requests, those samples we receive, and the labs themselves will analyze body fluids from bloods, urines, cerebral spinal fluid, and many other samples. But we analyze those to help to hopefully get results to aid in the treatment, the diagnosis, and the final treatment for these patients. We work together. There's many labs at St. Peter's, and we all work together to help aid in this diagnosis for patients.
And that's really important because a lot of patients don't really know that you're here. You know, they think maybe the doctor somehow it's an automatic diagnosis, but really the doctors rely on those tests that you're performing. And I would imagine it's really critical that you all really work together.
Yes, its main concern is definitely turnaround time, especially for those that are been admitted to the ER. So you have to work efficiently and together, and each result that you get will hopefully solve that puzzle, pieces of the puzzle for that patient, and for the doctor to provide the correct treatment that is needed. The medical technologists in the lab perform complex tests using automated instruments and specialized instrumentation like microscopes and cell counters. So with the use of that technology, we are able to process more samples quickly and efficiently, which is very essential for patient care.
And what types of patients really rely on these services? Is it patients that are admitted? Is it patients that are coming into the ED?
You get patients, outpatient work sent to us from off-sites, and then you have patients that are inpatients and patients that have been admitted to the ER. So there's a lot of samples being processed, and it's critical to be conscientious of what you're doing and aware of time constraints, especially for those that have been admitted to the ER, especially for like cardiac patients. We try to get results out in a very timely fashion, just due to the severity of depending on the patient's condition.
Great. And is there anything else that you would like, patients or providers to know about the role that you perform in the hospital setting?
Well, the hospital is made up of many clinical labs. There's the hematology lab that we work with, and they look at the blood health of the individual. They'll look at the red blood cells, which are essential for moving oxygen through the body, the white blood cells, which is your, what is the word I'm looking for? To fight infections and for clotting factor issues. So hematology is important for providing that information. We have the blood bank that will responsible for preparing patients' samples. Their plasma samples for transfusion, but they have a critical role in making sure that each unit of blood that's getting transfused is going to be compatible with the patient receiving it. So they have to do a lot of typing, antibody screening, making sure that the blood and blood components each patient receives will be compatible for that patient. So a lot of time and effort and care is taken in that department. For micro, we have They do a lot of identifying of bacteria and microorganisms, which help determine what could be causing certain infections. And then the lab itself, we do a lot of processing of more of the body fluids. Like we do urinalysis testing, which helps to aid in like diagnosing diabetes, kidney issues, and everything for the urinalysis is based on the appearance of the urine, the concentration, and the content. Also in the clinical lab, we do blood gas analysis, which is essential for patients to monitor their lung condition of the oxygen moving in and the carbon dioxide being removed from the system. So that's important. And then the other aspect of the lab would be the processing of the urine, the bloods, and the CFF fluids, the cerebrospinal fluids, which we use the automated systems. And those are essential for helping determine the chemical and the hormonal component of those samples, and that is used to help with watching or diagnosing what's going on with liver function, kidney function, the electrolytes of a particular patient, glucose levels. We do HIV testing. There's a lot of information that can be obtained from samples that have been processed through the lab, especially the blood samples. We use their serum, and getting results helps to provide the information that is needed for the doctors to address the health issues with their patient.
Great. And, lastly, what is it that you love about your job?
I love that we're helping others. It's not me and what I do, but it's what we produce together as a team and working together to help the community. The community is the hospital community and the surrounding areas. And I feel that we offer a service. We offer a service that's open 24 hours a day, 7 days a week. And we are there for the patients to help in any time they're in any type of crisis or just for routine checkups. And I like the fact that, you do get patients that come in and they're critical, and then you know that they have left, so you know that you have contributed to somebody's recovery.
Wonderful. Thank you so much for helping us learn more about your profession, and we thank you for joining us today.
Oh, thank you.